Yes, this doesn't mean everyone who was told their surgery would have to wait a month ago will be able to re-enter an OR. Doctors of the Texas Medical Association explain the surgery has to be urgent or emergent to get through because there has to be enough PPE for everyone and test screenings. Elective surgeries have been put on hold in Texas for nearly a month, a painful position for both patients and doctors. Orthopedic surgeon Dr. Charles Hubbard has been able to see his patients but unable to operate on them.
People are really in pain now, and that's the issue. Is as physicians, it's hard to see people that are in pain that you can fix, that you can't.
The governor's executive order to reopen Texas has allowed for more surgeries to take place, but not all.
If you have an elective, non-urgent elective surgery, really those can't happen yet. Okay, the governor has opened things up, so emergent and urgent surgeries, more of those can be done than what it was before.
The executive order has some exemptions before physicians can operate. Hospitals need to reserve 25% of hospital capacity for COVID-19 patients, and no additional personal protective equipment can be requested. Each facility is following strict guidelines put in place since the beginning of the pandemic to mitigate the spread.
I get 2 or 3 emails from each hospital system each day talking about, what they're doing. And the number one thing that keeps coming up at the front of every email is what about patient safety.
Dr. Hubbard says although restrictions have been lifted, he is going to wait before re-entering an OR.
I personally am not doing elective surgeries for at least a couple more weeks. I don't want to be the first one going back in.
President of TMA says ensuring hospitals and physicians have resources necessary to keep them and their patients safe is the top priority.
Ultimately, what we need to do is make sure that we have adequate PPE in our communities, and we're getting there, but we're not there yet. And then testing becomes very critical for this.
Some facilities are requiring that patients get tested 3 days prior to their surgery. Follow up with your physician to see what those next steps are. Reporting live downtown, Natalie Martinez, Fox 7 Austin News.